Hi, everyone. Sorry I can't be there with you today. Unfortunately, I'm home with COVID, but to continue our conversation on polyps, so we thought we'd discuss some of the common causes and risk factors that are associated with them. So in industrialized countries like the United States, you'll often see a pretty even spread amongst men and women of all races. There are some lifestyle influences that could increase your chances of having polyps. So those are diets that are high in fat, high in red meats, or low in fiber, which are commonly associated with industrialized countries anyway. There are some confounding factors like cigarette smoking and obesity, which are just pretty general across the board for any disease. We've talked about this a lot, but aging is pretty important in the chances of getting polyps. They're uncommon before you're 40, but Nate will talk about this later. It's not impossible. But they are more common as you age. Just as you age, you have more time for mutations to develop or any sort of double hits to happen for you to get cancers. And so to answer question number 3, at what age are they most likely to occur? If you look at this graph here, you'll see the occurrence of polyps and the frequency increases significantly as you age, with the buckets the highest in the 50 to 60 or 60 plus range. So this is the 6th or 7th decade of your life. Again, not impossible to have them younger, but just more likely as you age. So the answer to this question would be during the 6th and 7th decades of your life. So why do we care about these benign polyps? People can live with polyps. It's really not the end of the world. It's important to keep an eye on them and to get colonoscopies regularly, as your doctor suggests. But it's just thought, again, as you age, that there's a decreased epithelial cell turnover rate, and that this delayed shedding then creates sort of like a buildup of goblet cells. And so that's what you'll see here is like a serrated. And if you don't know what serrated means, it's just all of these bumps and ridges. A lot of people will hear it in referring to knives. So it creates these bumps and ridges across the epithelial layer, which is a hallmark of something that doctors look for when looking at polyps. What we've been talking about with hyperplastic polyps for this patient, they look histologically pretty similar to other polyps, but it's important to be able to differentiate them from serrated or sessile serrated adenomas, which are, if they're not removed completely or treated properly in a certain period of time, then they can develop and become cancerous. And so this is just to walk you through it. So this is what a normal mucosa looks like. But then our patient has a hyperplastic polyp, again, benign, not the end of the world. You do see some serrating here, as you'll see with this crypt alteration. And then you move on to sessile serrated adenomas, which in this picture does look significantly different in the histology, but you'll see in some other pictures, some of them are really hard to differentiate. But you'll notice that there is some differences in the crypt, but you do still see the serrated appearance. So the question 4 was, what is their clinical significance? So hyperplastic polyps don't really have a clinical significance, but they need to be distinguished from the sessile serrated adenomas, which do have malignant potential. And just to give you an example, this is our patient here. So you see this piling up, this crowding of the goblet cells, and it creates a little bit of like a serrated pattern. And to make this a little bit clearer or a little less clear, here is the hyperplastic on the top, and the bottom you'll see the sessile serrated. And so at first glance, these look really similar. And so it's important that the doctors have an appropriate histology reader, histologist, so that you can make sure you have an accurate diagnosis. And from here, I'll pass it on to Nate. Thanks, guys.